is the period beginning immediately after the birth of a child and extending for about 6 weeks. It is the time after birth, a time in which the mother's body, including hormone levels and uterus size, returns to a non-pregnant state. It is also called puerperium. Goals of postpartum care: assist and support the woman's recovery to pre-pregnant state and identify deviations from the norm. Educate mother about her own self-care and newborn feeding care. Promote bonding between newborn and family. Dangers in immediate postpartum: hemorrhage or hypovolemic shock and infections. First 24 hours after birth, all postpartum women should have regular assessment of vaginal bleeding, uterine contraction, fundal height, temperature, and heart rate. Blood pressure should be measured shortly after birth. Urine void should be documented within 6 hours. To fully assess a postpartum mother, thereby preventing complications after delivery. Assess for the client's level of consciousness and ability to follow the instructions. Method and date of delivery, number of postpartum days, and vaginal signs of the mother. Fully assess, educate, and validate knowledge of a postpartum mother care. Initiate nursing interventions for abnormal findings and document the findings. Then prepare the materials that will be needed. Identify the correct patient, introduce yourself, and state the purpose of the intervention. Provide the client's privacy. Set the bed to a comfortable height to work and lower the side rails where you will work, and do hand hygiene. Check the mother's vital signs and record. Wear clean gloves. Place the client in a supine or sitting position. Open the gown opposing the breast to be examined. Inspect the consistency, nipple type and integrity, swelling, redness, engorgement, and tenderness. Then, tie the gown. Expose the client's abdomen, covering the upper part and the lower extremities. Assess the tone, height, and location of the fundus. You can ask the client whether she moves her bowel or not, or whether flatus is positive or not. Auscultate for bowel sounds and assess for abdominal distention. Ask the client for the voiding pattern, presence of pain or burning sensation during urination. Palpate for bladder distension, track fluid balance, intake and output. Assess the amount of lochia. Note time of last perineal pad changes. Note for the amount of lochia on perineal pad. If weighing perineal pads, 1 gm equals to 1 ml of blood loss. In lochia rubra, 1 to 3 days is red in color. In lochia serosa, 4 to 10 days or vaginal discharges are brownish pink in color. 11 to 21 days, vaginal discharges are yellow to white in color. Document number and size of blood clots. Turn the patient to assess for blood loss under the buttocks. Remove medical gloves and do hand hygiene. Wear sterile gloves. Place the patient in lateral position with her back facing you. Expose the client's buttocks. Palpate the edges of the stitches using either your thumb or index finger, noting for the presence of discharges from the stitches and pain upon the palpation. Dispose or arrange used materials properly and do hand washing. Record all data in the client's chart. And refer any abnormal findings to the attending physician.